My guest today is Dr. Joshua Levitt, who is a naturopathic physician who has helped thousands of patients with natural solutions to common, chronic, and complex medical problems. His primary focus is on painful orthopedic and musculoskeletal conditions and helping people understand and treat their pain at the source. Dr. Levitt is also the co-founder and medical director at UpWellness, which is an 8-figure company where he created a line of premium natural products that work. In today's episode, Dr. Levitt gives you practical tools and techniques to live your healthiest life. Welcome to LIFEOLOGY.
It is a pleasure to be here. Thank you so much for having me. I hope I can provide some value. I know you got a lot of listeners out there. I'm guessing that a few of them have some pain, so let's get into it.
Yes, I'm excited about this. Now, my viewers and listeners also know I always like to get someone's origin story. How did you decide that this is something you wanted to get into?
This is a great question. So I was one of those kids that always wanted to be a doctor. I went to UCLA and studied neurophysiology. As a result of that passion and pursuit, I thought orthopedics and sports medicine was my zone because I'm a surfer and a skateboarder, lots of fractures and sprains and strains. After college, I took a year off to do kind of a travel walkabout with a backpack and hitchhiking, sleeping on beaches. Needless to say, my hygiene wasn't the greatest at that time, you know, living off of tuna fish and living out of a backpack. During that time, I got a blister on my foot that became infected. I got a problem called cellulitis, and I found my way into a pharmacy in Switzerland, which is where I was at the time. And I needed antibiotics desperately because this was a very serious situation. So I got the antibiotics, which took care of that problem, which could have been like life or at least limb threatening. Yeah. But in that pharmacy, in contrast to anything I had ever seen or experienced before growing up in Southern California, coming from the land of conventional medicine, there was all this herbal stuff. There were homeopathic remedies in there. There was tea, there was aromatherapy, there was all this natural medicine, right? And at that time, I needed antibiotics, but I also was exposed to this different world. And that world that I saw that day, on the day that I needed antibiotics, kind of ironically, lit up a fire in me, a passion that really is still burning hot right now. And so now I find myself on this bridge in between mainstream medicine and all the beautiful things that it represents and alternative medicine and all the beautiful things that are there. And there's good and bad on both sides. So I find myself now, honestly, 25 years later, on that bridge, navigating that interface between the West or the conventional medicine and alternative medicine. And that's where I am now.
That's amazing. It's so interesting. The past maybe 4 or 5 interviews I've done, everyone seems to be finding that space as well from different verticals or different backgrounds, looking to merge as much as they can from just naturopathic to Western medicine as well. But what's interesting though is I'm curious, since you're more of a pioneer in this, if for lack of better words, how are you finding that some of your colleagues may not yet be on board with the merging of those two worlds?
Yeah. I know it's funny. I think of myself sometimes. It's crazy to think it's been like 25 years since I've been practicing natural medicine. I'm kind of like an OG, which is weird because I don't think of myself that way. But this was a time when organic food was just catching on. Whole foods wasn't really a thing. And now it's like, wow. So yeah, where are my colleagues on this? This is a great question. There are some people that are fully on board, but the way I would describe the answer to that is on both sides, like in the alternative or natural medicine world and in the conventional medicine world, you have dogma and a negative dogma. And that dogma is on the natural medicine side that all Western medicine is bad, right? It's profit driven, big pharma, bad. And then on the conventional or mainstream medical side, you have a dogma that says all natural is bad. It's just quackery. It's just a bunch of snake oil. And so I don't believe that either of those positions are true. I think there's value on both sides. And I think that the smartest, most progressive minds in both of those worlds understand that there is a limitation to their knowledge base, right? So a really smart progressive acupuncturist is going to understand that there's value in what they do, but there's also a limit to what they do. And I think the same thing should be true for a neurosurgeon or an orthopedic surgeon or a gastroenterologist or whatever. So that's how I would answer that, is that there's still some work to do. There's no question.
Yeah. It's interesting you say that because so in my field, so with my clinical license, and just with yours as well, you have to stay within the parameters of what that is. And so I know, okay, well, I can't talk to someone about this because it's not within the purview of the scope of my licensure. I think that's a good point when it comes to different medical providers or whomever, whatever side, to be really specific about what is within that spectrum. And so I think sometimes it can be clouded I know at times I had to be careful because I'm like, oh, that's cloudy. But when I
Yeah.
really go back to what is the scope of my practice, I have to be really specific about that. So I think
And
maybe
I think
sometimes people just get
you're
lost in
so
it.
right about that. And I think the problem, I think we wind up with a lot of ego or hubris in Western medicine
Mm,
that like where here in this country, and this is different. This is why my experience in Switzerland was so different. Over there in Europe and mostly in the rest of the world, there's this acceptance that older natural medicines are still useful. But here in this country, I think with the growth of better living through chemistry, big pharma, and modern surgical techniques, that like we think that Western medicine has all the answers, right? It's just drugs
yeah.
and surgery. And I think that's a huge mistake because it leads to high cost. It leads to excessive or overuse of interventions like drugs and surgery.
Hmm.
And it's really easy to get an MRI and say like, oh, there's something I saw that was abnormal on that MRI. Surgeon said I need surgery. It must be true.
Yeah.
Well, I'm here to
Yeah.
tell you it's not always true. There's a
Sure.
lot of room to work in the natural medicine realm, even in things that most people wouldn't think of, like
Hmm.
orthopedics, for example, or musculoskeletal pain, that would lend themselves to a natural approach. So yeah, so
Yeah.
it's you bring up a really interesting point there, and a problem. I think we have some growth to do in Western medicine here.
Oh, certainly. One of my friends is an MD PhD, and he was doing a lecture at a conference, and he was talking about the naturopathic aspects of it. And there's a lot of the MDs were scoffing. So he pulled out this bag, and inside of it was poison ivy. And so he was like,
Mm,
"Who wants to touch this?" And everyone's like, "No, I don't want to touch it." And he says, "Why?" And then of course it's poison ivy. And he said, "Well, do you see how much of a response your body gets just by touching that?" And so it was a really good example of the power of the naturopathic aspect, because there is so much there that people automatically have an aversion towards. So it was really interesting. It kind of made them look at, okay, maybe there's something. So that was how he started his lecture, and it went pretty well.
yeah, that's a good way to do it. I mean, I mean, I think a lot of that scoffing comes from, oh, those medicines are just, it's like chamomile tea or something, right? It can't be
Yeah,
very strong. But when you think of like what harm can be done by things that are natural, yeah, that changes the way
it
that
certainly
these
does.
docs are going to think about it. And yes, there's a lot of power there, on
Oh,
for
certainly.
the good and for the dangerous in the natural
Yeah.
medicine world as well. So that's a good way to start a lecture. I'm gonna have to use that one. There's plenty of poison ivy around here right now.
I'm sure there is. Now, with all the patients that you see, you either see them, in your clinic or through UpWellness, all the different aspects that you do. What do you find is the common struggle with the inflammation or the pain that people have?
Yeah, so much of my practice and the work that I do is devoted to people who have musculoskeletal pain, and I
Mhm.
think that in piggybacking on what we just said about the Western medical approach, the idea there is just to suppress the symptoms, and that might be
Yeah.
drugs that are anti-inflammatory or injections
Hmm.
or surgical, debridements like a meniscus repair or even a full-blown knee replacement, that sort of thing. And so my work, I think, tries to be more holistic or comprehensive. Like the way I like to say it is that I've never seen like a knee come in my office or a hip or a heart or a kidney, right? It's always so far been inside of a person, right? So there's a
That's right.
problem, there's a symptom,
Yeah.
and then there's a person in whom that problem, that joint, that organ, that symptom resides. And so when we pull back and take a look at that whole person in whom that painful knee resides, you start to see different things. And it's not just like, oh,
Mm.
that knee needs to be replaced. So I would go through a few things, when I have a person who has some kind of joint pain or musculoskeletal pain. And the big areas where I like to look, there are four of them. One of
Okay.
them is at inflammation, but not just inflammation, excessive inflammation, more
Mm.
inflammation than there ought to be given the stimulus. And we can talk more about that, but excessive
Yeah, I'm curious
inflammation
about
will be number one. Number two would be myofascial tension, muscle or fascia, which envelops the muscle in a tense or fibrotic state. So
that.
that
Okay.
muscle tension can exacerbate or cause
Hmm.
pain that you can't see on an image like an X-ray or an MRI. Number three would be fibrosis. And fibrosis is something a lot of people don't think about too much. And that's basically gristle, right? It's scar tissue formation, which occurs at the site of a chronically irritated or injured area or something that was acutely or seriously injured in the past. One of the
Yeah.
reasons why an old knee injury might turn into an arthritic joint later is because there's all this fibrosis and scar tissue around it.
Interesting.
So
I
we have
didn't realize that.
inflammation, muscle tension, and fibrosis. And then the fourth, and one that I think is especially important, and I'm sure you can relate to more than most people, given your background, is psychosomatization, right? The
Yeah.
mind
Yeah.
body
Yeah.
influence, right? The influence that our perceptions of pain and the stories we tell ourselves about the pain that we have a massive influence on our experience of that pain or of that symptom. So when we tackle those four subjects, the inflammation, the tension, the fibrosis, and then that whole psychological, emotional
Mm-hmm.
piece, people get better. People can get
Yeah.
better from really serious things.
And it sounds like you really listen to your patients because, I mean, not that other people don't, but sometimes if
What a
you,
concept, right?
yeah, I know. Sometimes when you have an intake with a doctor, it's very short and it's for whatever reason, they're very busy, et cetera. But it sounds like you do really take that time with your patients to understand those minimum of those four categories to help them be able to tell their story. And I think sometimes when people feel heard, that they emotionally join with you, and then yes, they're on board with whatever treatment modalities you have. Now, I wanted to ask you. So, when you talk about the excessive inflammation, is that something I would be able to recognize? Oh, this is excessive, or is that something you would have to be able to tell?
Yeah, that is a great question. There's a lot of different ways to recognize it. Inflammation is a word that's named after fire. Inflammo, it means to set
Mm-hmm.
ablaze, and inflammation and fire have a lot of similarities. They're hot, they're red,
Mm-hmm.
and they bear a lot of similarities. And what we're talking about here is a response. Inflammation is a biological imperative, right? People think it's just bad, we should suppress it, but it's not. It's a good thing. It's necessary for healing from injury or
Mm-hmm.
infection. What happens when it gets excessive, which is something that both doctors and patients themselves can notice, is an exaggerated response to whatever the stimulus may have been, right? So it could be a mosquito bite, or you stubbed your toe, or you have an autoimmune disease. And if that problem is redder, hotter, more painful, more swollen than one would expect, either clinically, like looking at the
Mm-hmm.
knee or the finger,
Mm-hmm.
or on laboratory tests, and there's many different tests that can be used to assess this, things like sedimentation rate and CRP, we can get into the details later. That's the problem. And because a healthy, well-modulated inflammatory response is like a fire. It's just like fire.
Yeah.
If we use fire to cook, we use it to keep
Mm-hmm.
ourselves
It's
warm.
fair.
But when fire escapes the stove and catches the house
Yeah.
on fire, or escapes the fire pit, it's very destructive. And the same thing with inflammation. Contained and controlled, it's fine. When it escapes and it becomes excessive or out of control, it's a devastating force, just like a
Mm.
fire.
Yeah. That's interesting. Yeah, I like how you really normalize inflammation is not necessarily a bad thing. And I think sometimes we often think it is because, oh, I'm inflamed, whatever. And so therefore there must be a negative aspect that's attributed to that, which is, I'm glad
Yeah,
you
it is. It's an
normalize that for us.
interesting thing, right? What a balance that is. I mean, if you don't have inflammation, then you can't ever heal or recover or,
Mm-hmm.
deal with an infection. Absolutely a biological imperative, but it's also at the same time one of the most destructive forces and associated with virtually every chronic disease we
Yeah.
know. So that's a tricky balance to
Yeah.
strike there.
I
You
can
know,
understand that. Yeah.
yeah.
Going to the myofascial aspect of it, can you explain more about what that is? And, people who go to the gym, they use their foam rollers, et cetera. Can you talk more about that? So maybe some practical tools that we can use today to help us.
Yeah, for sure. Let's start with just an example that kind of frames this really well. It's so common for people to have had a kind of a minor, let's say a fender bender kind of accident, right? A little
Mm-hmm.
bump, wasn't anything too serious, didn't call the paramedics or anything like that, just a little jolt, and everything's kind of okay. Go exchange insurance and go about your business. And then the next day or 2 days later, it's a nightmare, right?
Yeah.
Neck pain,
Yeah.
back pain, whatever the case may be. What's going on there? Was the original injury so serious? No, because if it was that serious of an injury, you would have called the paramedics right
Mm-hmm.
then.
Mm-hmm.
It was a minor injury, relatively speaking, with a major response. And the major response very often is muscle tension. So muscle tension is actually protective, believe it or not. Maybe there was an injury to the neck or whatever joint. And then the muscle tension is a part of the biological response, not unlike inflammation, to protect you in the same way that we put a cast or a splint on an injured joint to prevent it from moving.
Mm-hmm.
Muscle tension is a protective response to prevent a person
Interesting.
from moving an otherwise injured area. Now, here's the problem. When that muscle tension is exaggerated, just like excessive, or persists for extended periods, it
Uh-huh.
becomes part of the problem. So a tender or tense
Okay.
muscle around a knee that was minorly injured will cause that knee to be more problematic and more painful for an extended period. And there's all kinds of reasons why muscles excessively spasm or become excessively tense or
Hmm.
stay excessively tense for extended periods. And those really come down to like diet, lifestyle, posture,
Sure.
stress,
Sure.
all
Yeah.
these kinds of things that increase the risk that a person's going to have an exaggerated muscle tension
Hmm.
response. So
Hmm.
that's how that goes. And the other example, that I think is worth noting is that when you have those risk factors in place, it's really rare that you're going to go get a massage and then feel better for many,
Yeah.
many months after that, right?
Yeah.
These are
Sure.
temporary solutions because
Yeah.
it's great. Hot tubs, massage, acupuncture needles, foam rollers, whatever. Those are great for addressing muscle tension, but they rarely provide long-term extended relief
Mm,
because the underlying factors that led to that muscle tension in the first place haven't been
sure.
addressed. So
Yeah,
that's
that's
the work
fair.
that I do.
Yeah, that's in fact, I didn't think about this till just now. I have one of those muscle guns. It's a muscle relaxing gun, so it has like the different attachments. So if
Yeah.
so, I I don't know what's going on. In the last couple of days, I slept wrong, and so like right around my scapula, there's like this huge knot, and so I'm like trying to use that little muscle gun to get to it. But yeah, I mean things like that. It's the natural things of just you're not, whether it's an accident or not an accident, you just sleep wrong. It's those things can really be debilitating, and it's interesting how people just have something even in their shoe and that's all they can think about. So I can't imagine how it is for people who have chronic pain or just even any
Yeah.
type of pain at all that's constantly present, and so their threshold has been increased, and so therefore from a psychological approach, the individuals like that who are struggling with that, I can't imagine how their mood would be, how their sleep would be, how their interaction and how they show up in the world, because it's such a chronic struggle.
Absolutely. And that's actually that fourth piece, right? It's so critical because as you're well acquainted, like pain is a signal, right? It's a messenger
Hmm.
and it tells our brain that there is danger, right? So like I always use the example of, again, fire, right? If you put your hand near a fire, it's going to start getting really hot and then it's going to become intolerably hot. And
Yeah.
then you're going to have pain and that's going to tell you to move your hand away from the fire. It's very primitive, right? So like
Hmm.
pain kicks up fear and then changes our behavior, like move
Yeah.
hand away from fire,
Yeah.
right? It's really simple. But when a person has a chronic thing, like a chronic arthritic kind of degenerative sort of thing, they kick up those same emotional reactions, right? It generates fear. And then it
Mm.
wraps up in the stories that we tell ourselves. Am I
Becomes
not going to be
chronic.
able to perform in my sport? Am I not going to be able to do my job and make my money? Am I not going to be able to walk, And then those
Hmm.
stories get told and retold through our own internal filters based on our own experiences and backgrounds. And yeah, all of a sudden, something that was a minor annoyance turns
Hmm.
into a major disruption. And
Yeah.
if that part's not addressed, you're never going to get complete resolution, right? So
Hmm.
yeah.
And unfortunately, with situations like that as well, I think if people aren't aware of it, then that pain becomes the label of who they are. I am James who has chronic pain. And once again,
Yeah.
not minimizing anyone's struggle at all, because pain is pain. But it's important to make sure that we don't label that as who we are, because there's so many more facets of who we are, to be able to move the focus of our life in other directions as opposed to whatever that struggle is.
100%. You're good at this.
Oh,
Yeah,
well, I
you
mean, I've
got
done
it.
it for 25 years too. I wanted to
Right.
transition though into the gastrointestinal health, the gut health. What is something, because it's, as you know, well, of course, it's all linked together. What's it? 90% of serotonin is created in your gut. 50% of dopamine is created in your gut as well. What are ways in which you help your patients really be mindful of that struggle of the gastrointestinal
It
chronic
is.
gut health?
I think like I'm pretty sure it was Hippocrates, the father of modern medicine, that said all disease begins in the gut, right? And this was at a time
Mhm.
before he knew very much about,
Yeah,
the
brilliant.
gastrointestinal microbiome or anything like that. But I think there's a lot of truth there. The gut is exposed to the outside world, if you think about it that way, right?
Hmm.
Like it's a tube that runs through our body that's exposed to the outside world, right? The foods that we eat and
That's a
whatnot.
good
And
way to look
if
at it.
that
Yeah.
tube is compromised, right? If there's a permeability problem, or if there is a problem in this ecosystem of microorganisms that inhabit our
Hmm.
GI tract, all hell can break loose, quite frankly, and
Yeah.
it can be the origins of diseases that both inside the gut and outside the gut, including neuropsychiatric problems and immune system problems, and all endocrine disorders all can have their root in this in the GI tract. So I would say, there's a lot of different things to address, and every patient is different. But first, the diet, which we want to be minimally processed, whole foods, kind of diet. I call it down to earth eating, the sort of perimeter of the grocery store, foods that look like they did when they came out of the farm or the field, or at least as close to that as possible. And then I put a lot of attention on a person's ability to digest food and break it down into its component parts. And that's the reason why digestive enzymes are such an important part of my practice and my sort of clinical toolkit. I also put a lot of focus on the health and diversity and balance of the GI microbiome, which is that ecosystem of trillions. It's crazy. It's trillions of microorganisms living there, tens of thousands of different species. And a decreasing diversity there can lead to health problems across the board. So probiotics and restoration, you kind of think of it like a garden metaphor. Like you got to kill the weeds, you got to plant the new seeds, and you got to nourish those seeds so that you have a lush, diverse, healthy garden, because it translates to broad overall health. And then I use also a lot of adaptogenic herbs, which are herbs that help with stress management, because stress has such a major impact on the GI tract. So those are my big tools. I would say digestive enzymes, probiotics, and adaptogenic herbs.
Interesting. We only have about a minute and a half left, but I want to transition to UpWellness. Tell us about that, because I know you have a lot of supplement lines that I'm sure address everything we've discussed today.
Yeah, we do. And UpWellness is a company that I created, co-founded, that's basically a whole bunch of different formulations that are based on my 20 plus years of clinical experience. So what basically happened was, I'm seeing patients and I'm using formulas, I'm mixing herbal tinctures, just like an old school sort of apothecary doctor, and realizing that there's some gaps in the products that are available. And so UpWellness was born of that need, right? Of the need to sort of create formulas that made sense for the patient populations that I was seeing, and for me to be able to reach people with the kind of advice and products that I use in my clinic to people that are outside of my clinic, living in other states, living all around the world. So my way of kind of outreach and filling gaps in supplement formulations and reaching people that I couldn't otherwise reach. And that's what UpWellness is.
Wow. I really like that. I mean, nowadays we were talking about this in the pre-call, as far as how it's amazing how with technology nowadays we can have a brick and mortar place somewhere, but you can have a reach, and it affects so many people worldwide. So I'm really glad that you guys are doing so well and being, once again, pioneers in this industry as well. We only have a couple more seconds here. What's next for you?
What's next for me? So it's basically just more education, reaching more people with more products. That's what UpWellness is all about. I'm really leaning heavily into the education side of things, and that's really where I see it. I think people need to be educated about the kind of things we talked about today, which is why it's such a pleasure to be here. And there's just going to be more of that coming online every day now.
Well, wonderful. It's an honor to have you on my show. Unfortunately, our time is up. If my viewers and listeners want to find out more information about you and to purchase your products and learn more about UpWellness, where will they find all this information online?
It's easy. That's a great question. Check out upwellness.com, www.upwellness.com. I'm also on Instagram. That's at Dr. Josh Levitt, Dr. Josh Levitt. And then they can even find me on TikTok these days at UpWellness, where we get a lot of views over there as well. I'll see you there.
Awesome. Well, awesome. My viewers and listeners also know that if you can't find this information any other place, simply go to the show notes at jamesmiller.lifeology.com, and I'll link you with Dr. Joshua Levitt at upwellness.com. Thanks so much for being a fantastic guest on our show today.
It was a pleasure.